Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Welcome to the media who are in attendance also this afternoon. Thank you for your questions that are already coming in. And a reminder that if you have not yet submitted your question, you can just click on the text bubble with the question mark in it here on Microsoft Teams. And if you could indicate your name as well as your media outlet and who your question is for. Finally, a welcome to listeners who are tuning in on Global News Radio 980 CFPL, viewers on Rogers Television as well as the Rogers Facebook page and YouTube channel, and those who are watching us this afternoon on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. You know, we've had so much tragedy over this last while with the discovery of remains of Indigenous children in Kamloops, and just more recently, the 100 more remains of Indigenous children near Brandon, Manitoba. Our hearts truly do go out to the Indigenous communities across our country. And of course, this week has been a week of grieving and mourning for the Afzaal family and their son. And it was an incredible outpouring from London, Canada, and the world. And I can never be more grateful on behalf of our grieving community than to say thank you to those who reached out. And now, of course, we have the recent killing of an RCMP officer in the line of duty, and it's just all too tragic. And I would say from my heart, may they all rest in peace. Look, let me say that after our first weekend of many businesses being allowed to reopen after a prolonged shutdown, I'm pleased that the vast majority of Londoners are acting responsibly. So I spoke with the head of our bylaw enforcement with the focus on this past weekend, which was to engage restaurants and operating outdoor patios. Together with public health inspectors, the bylaw officers visited a number of patios and provided education on the regulations. With all these interactions, there was only one instance where a charge was necessary, and this fine was issued to a restaurant with a history of prior violations. But all told, I'm encouraged as to how Londoners have conducted themselves over these last several days, and I'm looking forward to them maintaining that same level of commitment as we work through COVID and as we beat this insidious virus down. The truth is, we've seen this movie before. This isn't the first time or even the second time we've reopened after a lockdown. This time and together, we need to write a different ending. The last few times, the ending has been a spike in cases, more hospitalizations, more deaths, and ultimately more lockdowns. Nobody wants that at this time. So let's write a different ending. Let's ensure the most recent lockdown was our last lockdown. And to do that, let's not fall victim to complacency. In addition, we all know, in addition to continuing to stress the need for people to get their first or second shot, I truly believe complacency will be the most significant threat to the success all of us want to achieve where reopening is concerned. Yes, we've started to reopen, but COVID remains. Not only that, but tens of thousands of people are still without a second dose and therefore remain vulnerable. And we still know that there are a significant number of individuals who have yet to have their first shot. We should celebrate, though, how far we've come and enjoy the freedom associated with these newly restored activities. But we must do so while maintaining our commitment to the basics. Avoid indoor gatherings when possible, wear a mask, wash your hands, keep your social bubble as tight as possible. We've come so far over the last few months in particular, and I know Londoners have been so weary, but you've done well, truly have. Let's not become complacent this time. Let's keep working together so we can write a different ending to this reopening story, one that will mark the end of COVID and the return of life as we know it. Over to you, Warden Cathy.
Great. Well, thanks very much for that, Mayor Ed. After what can only be described as an incredibly emotionally charged week, I hope that this week marks the start of healing and recovery for not only a grieving and broken family and community, but for a city, a region, a province, and really the country as a whole. We must look inward to put action behind the words of inclusivity, tolerance, and acceptance. On the COVID front, we can be rallied by the numbers of positive cases across our region. And of course, we are buoyed by the entry into stage 1 and the loosening of restrictions and the limited reopening of non-essential retail and of course, patios. Let this be a gentle reminder to enjoy all of this responsibly. I'm pleased to bring you an update on the Middlesex-London Paramedic Service Vaccine Program. You will recall that we announced that MLPS had been provided dosages above the allotment to our health unit so that targeted demographics and workplaces could be vaccinated. This was a great news announcement, as it is expanding the reach of vaccines by bringing doses to arms in a way the health unit is unable to. Last week, the MLPS community paramedicine team was out vaccinating homebound people who really have no way of getting to a mass clinic site. These visits will continue in the days to come. They were also out in the county at 2 medium workplace sites, and this week they are in the city, focused on larger employers. Next week, the community paramedicine bus will be utilized to host a drive-through clinic serving 500 employees. The team has been very busy, and this program has been made incredible strides in getting shots into arms, helping to achieve vaccination goals for our region, while at the same time positively impacting the Middlesex-London economy. I couldn't be more proud of our community paramedicine team and the role that they have played right from the very beginning, starting with testing, both at our testing sites and through their mobile clinics, to supporting the MLHU mass clinics, and now to this program. So congratulations and thanks to our community paramedicine team. And to those that are listening, Dr. Dukelow, he probably won't remember this, but a couple of weeks ago, he thanked everybody for tuning in to these briefings. And that really struck me, because I don't think that we've taken the time to acknowledge not only the reporters that are online, but those that tune into various media to get updated on what is happening with the COVID situation in Middlesex-London. So thank you for doing that, because it is all part of how we are responding to the pandemic. And it is appreciated the time that you take out of your day to join us. Dr. Mackie.
Thank you very much, Mayor Holder and Warden Burghardt-Jesson. So the case counts locally and across the province continue to decline. We did have 18 cases reported yesterday. Some of those were carryover from Saturday. All told, very reasonable numbers. The big change today that we are announcing is around availability of vaccine. And I'll just back up. Last week, we issued a request through you and in partnership with the media for more vaccinators and clinic managers. By Saturday, we had over 1,000 resumes that had been submitted to work in our vaccine clinics. Truly tremendous response. We're deeply grateful to everyone in the media who helped get that message out. The timing could not have been better. And that was because on Sunday, we learned that the region would receive, over the next couple of weeks, 70% more vaccine than the last few weeks. Our normal allotment of vaccine is about 25,000 per week of Pfizer. In addition to that, the Middlesex-London Health Unit will receive 17,000 of Moderna. So going from 25,000 per week up to 42,000 per week, that's a huge jump. And it's exactly the sort of level of availability of vaccine that we've been hoping for, waiting for, planning for some time. And so to have those additional 1,000 resumes in the inbox of our HR department was tremendously well timed. This move will mean that starting next Monday, instead of vaccinating 4,000 people per day in our mass clinics, we'll be able to vaccinate about 6,000 people per day, and potentially even more the following week. So there are a few implications of that. For the public, that will mean we'll be able to accelerate second doses sooner. We're working with the province about what exactly that will look like, and there is a provincial planning meeting this evening. you can expect an announcement from the Middlesex-London Health Unit tomorrow about how far we will be able to open second dose rebooking. Again, the timing couldn't be better because we know that the Delta variant, which is the variant of COVID that's come from India, requires 2 doses for full protection. For the vast majority of COVID strains, 1 dose provides about 90% protection. For the Delta variant, that's more like 30–40%. You really need your second dose in order to get your protection up to 90%. So the fact that we have access to this huge allotment of vaccine right in time to prepare for Delta variant, we've had 1 case, really limited activity in this community of Delta variant, but we know it's becoming a driver in places like Peel and some of the other GTA and northern communities. We can be prepared by getting second doses into arms. So that's tremendous. And again, we'll have more details tomorrow morning about who will be able to extend that eligibility to for second dose rebookings. The provincial hotspots right now, there are 7 Delta variant hotspots across Ontario, and they're all rebooking second doses all the way up to anyone who has been vaccinated up to May 9th. So certainly that'll be a consideration. Again, we'll be speaking with the province and confirming that tomorrow, hopefully tomorrow morning. The implications for the Middlesex-London Health Unit are that we will really be pivoting our work, winding down for that 2-week period where we have dramatically increased vaccine supply. We'll be winding down almost all of the services across the health units, except for the very basic, keep the lights on service, where we know that there are absolutely critical issues that have to continue to be addressed. But most of our clinics, most of our outreach in other programs other than the vaccine, we'll be pulling those staff into the vaccine response for that 2 to 3 week period. So that's the implication internally. All in all, this is a great news story. This is because of the federal procurement of a large shipment of Moderna vaccine, and the provincial and local component of that. It won't necessarily catch us up to other communities because other communities are receiving a lot of additional Moderna as well, but we'll all be pulling forward together and catching up to where we need to be on the second dose front. That's it for me, Dan. I'm happy to pass to Dr. Dukelow to comment from LHSC perspective.
Thanks. Thank you very much, Dr. Mackie, especially for that very welcome news that we can advance the second doses for those in our community that are still waiting for the second dose. That's excellent news. And thank you for having me this afternoon. I'll echo both the mayor and the warden's comments around the tragic events that our communities have experienced over the past week or more, and how much of an impact that's had on all of us. And I'm fully supportive as we work through this and move forward together. As of this morning at LHSC, we're caring for 22 COVID-19 positive patients, 10 of which are in ICU or critical care. Of the 22 COVID patients, the number that we are caring for from outside of our normal referral area are fewer than 5. Yesterday, we declared a COVID-19 outbreak at University Hospital in our transplant unit. At this time, there are fewer than 5 cases associated with this outbreak. This is the first COVID outbreak at LHSC since early February, but it is a stark reminder that despite the improving situation, safety protocols, vaccines, and our amazing staff and teams, COVID-19 is still here. It is highly contagious and can lead to outbreaks. Our routine safety measures and procedures are in place, and we're doing everything we can to contain and limit the duration of this outbreak. As an additional safety measure, we are also limiting visitors to the 8th floor of University Hospital. We are anticipating the outbreak may impact our recovery efforts and our surgical volumes in the coming days. It may lead to cancellations of some cases, depending on the staff testing results and patient testing results that are occurring as we speak. However, it's too soon to speculate what the impact will be. Lastly, we'll remind you that our hospitals are safe and our emergency departments are open 24/7. It seems particularly poignant to do that today as we battle this outbreak. Please do not delay seeking care. We are here and have the capacity to care for you. Thank you all for taking the time to attend this afternoon. I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. We do have several questions in the queue, but a reminder to the media who are joining us this afternoon that if you do have a question, please include it here in the question forum on Microsoft Teams. Just click on the question mark in the text bubble and indicate your name as well as your media outlet and who your question is for. Let's go to the questions right away. Dr. Mackie, the first one is for you. It comes from Brent Lale at CTV London. Dr. Mackie, in regards to sports, medical officers of health have to sign off on approved leagues returning. Are you on board with a return to play in the province? And a follow-up question, how busy have the assessment centers been, and is there a plan for attendance threshold for returning these facilities to recreation, perhaps by hockey season in the fall?
Yeah, so thanks for the questions, Brand. On the first question about return to sport, you may be further ahead in terms of understanding that we did see an announcement this morning from the province that there would be a return to play, especially high-level elite play. The plans there seem to be produced in consultation with Ontario's Chief Medical Officer of Health. I didn't see anything about local medical officers of health approving return to sport, but if you have something on that, we'll be happy to take a look. At a principal level, we certainly believe that most sports can be played relatively safely with some adjustments, and that over the next few weeks and months, it will be appropriate for most sports to return to some level of play. On the next question around assessment centers, Brent, we certainly have seen declining volume in both assessment centers, especially over the last month or so. There will be a time sometime in the near future when you probably see those two assessment centers consolidating down to one. They are really operated by other partners. You've got London Health Science Centre at the Carling Heights Optimus Centre, and then you've got Thames Valley Family Health Team operating the Oak Ridge Arena Centre, and the Ontario Health is essentially the key provincial partner for them, where the funding flows through. The health unit was deeply involved in setting those assessment centers up, but we don't have a significant ongoing role there. And certainly I would, support the consolidation down to one assessment center when it's deemed appropriate by those partners.
Thank you, Dr. Mackie. Let's move to another question from Brent Lale. It's also for you. Dr. Mackie, people who got the AstraZeneca vaccine, when will they be able to book second doses of an mRNA vaccine at the revised 8-week interval announced by the province over the weekend?
Yeah, great question, Brent. That is essentially in play now. I think people can go ahead onto covidvaccinelm.ca, should be able to book their second dose there. If not now, then very soon. But that certainly is something we'll be implementing locally as well. I've had a number of people ask me, I had AstraZeneca, should I get my second dose of AstraZeneca? Should I get my second dose of an mRNA? These are all excellent options. If you're at AstraZeneca, you're in the lucky position of having 3 great options for your second dose. AstraZeneca, Moderna, or Pfizer would all be great. In particular, people that are wanting to make the transition to an mRNA vaccine, we truly consider Pfizer and Moderna equivalent for all purposes. And especially as you see the acceleration of the mass clinic campaign over the next few weeks, we will be giving Moderna and Pfizer, if they're available for second doses, we'll get you the same thing that you originally had. But if they're not, we're going to offer you the alternative. And again, they are essentially equivalent. The data is now strong enough to say that crossing over is no different than receiving a vaccine, same dose from your previous mRNA vaccines. The mRNA vaccines do generate great protection for those that have AstraZeneca for their first dose. They do often generate some real, side effects like fever, chills, muscle pain, sore arms, sore joints. Those brief side effects that are really a sign that your immune system is working well and last usually 24 to 48 hours. Again, anyone who had AstraZeneca, either mRNA vaccine or an AstraZeneca second dose, all great options.
Thank you very much, Dr. Mackie. Let's go to our next questions. We've got a couple from Jennifer Beeman at the London Free Press. Dr. Mackie, are you expecting the case count to rise slightly now that we're in the first stage of reopening?
Well, what you're seeing across the province is you're seeing the decline continue, but it seems to be beginning to level out. So the curve decreases still, less cases, the 7-day moving average moving down each day continually, but not as quickly as it was a couple of weeks ago. And so what I would say is that, with the weather coming into play so that people can get outdoors more and more vaccine getting into arms, especially over the next few weeks, we don't anticipate an increase in case counts. We may see things flatten out so they continue on at current levels or similar levels for some time, but we don't anticipate a fourth wave scenario in the next few weeks anyways.
It is encouraging to hear. Let's go to a follow-up question from Jennifer Beeman. This one is for Dr. Dukelow. Dr. Dukelow, is the outbreak at University Hospital linked to any variant strain? Do the cases involve vaccinated, partially vaccinated, or unvaccinated people?
Thanks very much, Jennifer. So the preliminary testing does indicate that the outbreak involves a variant strain. However, full sequencing of the variant to know which one it is not yet complete. And in terms of the vaccination status, those affected, we're still working on ensuring we have accurate details before providing any of that. Thank you.
Thank you very much. Our next question comes from Jane Sims at the London Free Press. Dr. Mackie, I think you answered this question, but we're going to just ask it again real fast. Dr. Mackie, Jane says, I'm looking for some clear directions for people who have 1 dose of AstraZeneca. Can they register at the mass vaccination clinics this week?
Sure can, Jane. I'm going to do a screen share here and walk you through how to do that. It's right on covidvaccinelm.ca. So it's right through that regular website that we've been using for some time. And we now have a part of the portal. There's a number of different options for booking, but there's a part specifically. So you've got, I'm 18 years of age or older. I'm 12 to 17 years of age. I'm Indigenous and 12 years or older. I need to rebook. So for people that are trying to rebook earlier, that's your option there. Then you've also got, I received my first dose elsewhere and now need to book a second dose. And elsewhere for these purposes includes pharmacies or family doctors' offices where people got Moderna. There's also, I need to cancel my second dose and a community clinic coming up in another community. So I've gone in and I've checked here. I received my first dose elsewhere. When you click continue there, you'll get a question about where, when you received your first dose, your eligibility, check one of the following categories. Where did you receive it, in Ontario or outside? What was it, Pfizer, Moderna, AstraZeneca? And then a note about your booking process. You need to, first of all, confirm that you are eligible for a second dose appointment within the next 4 weeks. That's the booking time horizon. We have 4 weeks worth of appointments in the clinic. And then you can confirm that your location information is correct and that you'll be using that information to pick the right location for your second dose. And then you go through into the second dose booking portal. I know over the weekend, we didn't have the logic yet implemented that people could rebook AstraZeneca at 8 weeks. That is now, or should be at some point today in the system. So, you know, if you're looking for moment by moment updates, you might want to enter a date, 8 or 9 weeks ago there, Jane, and click AstraZeneca and see what it gives you for options. But that is certainly available, and the timing of implementing that 8 dose horizon will be at some point today.
Thank you very much, Dr. Mackie. And I just want to mention that I know the team is working diligently to get that gate set up for the 8-week to 12-week interval. And yes, we're aiming to get that done as soon as possible. It may be tomorrow morning, but work is underway and we're getting that done. So yes, great news there for folks who are looking to get a second dose if they received the first dose of AstraZeneca. Next question is for Dr. Dukelow, and it's from Jennifer Beeman at the Free Press. Dr. Dukelow, What is LHSC's surgical volume at now? How much capacity is LHSC keeping on reserve to respond to COVID needs?
Thanks, Jennifer. So we are continuing our efforts to resume as many volumes as we can safely do so in a manner that's quite measured and sustainable. So this week, we are running 11 of 15 operating rooms at University Hospital and 14 of 17 at Victoria Hospital and 2 at our Surgery Center on Baseline Road. Unfortunately, as mentioned earlier, the operating room grid may be impacted at University Hospital by the outbreaks, but we're doing our best to minimize that impact. In terms of protecting capacity, we continue to have a goal occupancy of 85% of our beds being occupied, leaving enough room that we can respond quickly to a surge, COVID or not COVID related. Our current occupancy is just above 90%, which we are paying very close attention to and working hard with our both internally as well as with the regional partners to help with. However, if we look back a year and a half ago, an occupancy of 91% would have been an excellent thing. So we'll still be diligent to drive to 85.
Thank you very much, Dr. Dukelow. We are down to our last question, so if you have been sitting back waiting for an opportunity, consider this your last call if you're a member of the media who is just thinking about putting in a question for this afternoon's briefing. The next question, Dr. Mackie, is for you. It's from Jennifer Beeman. You know, as we've been going through this whole thing, the media, I think as Warden Burghardt-Jesson mentioned off the top, the media have been part of this journey with us. And Dr. Mackie, as you mentioned as well, with helping get the word out regarding the need for staff at the vaccination clinics. It's fun when questions come up that sort of show the excitement that people are feeling about the announcements that get made on these briefings. So here's Jennifer's question with that in mind. Dr. Mackie, when can the London area expect this bonanza of Moderna doses? Is the health unit administering Moderna second doses to people who received Pfizer first?
Yeah, appreciate the question, Jennifer. This really is the exciting news for us. I can tell you that once we received that news on Saturday, the senior leadership team met urgently Saturday afternoon to make sure we had all the pieces in place. The vaccine informatics and planning team, which allocates the doses to the mass clinics, met, through much of the day. Sunday, our HR team is scaling up to, process the 1,000 resumes, and we have already booked training for our staff Thursday and Friday, so we can transition staff as well as bring a new staff in to, how to use the COVAX vaccine tracking system and the processes and procedures that we use in our clinics. Our understanding is that the Moderna doses, that 17,000 that will be coming, will arrive sometime over the weekend, likely Saturday or Sunday, for delivery beginning in the clinics on Monday. So we've bumped our clinic capacity on Monday from just under 4,000 to just under 6,000 doses. And then the days following that, somewhere in the 6,000 to 7,000 doses per day range for those clinics. Very exciting. We expect to have another large delivery of Moderna. We don't exactly know the number on that yet, but that will be coming later next week. So not this coming Friday, but possibly as early as the Friday after that.
Good news indeed, Dr. Mackie, and exciting for folks who've been waiting to get that shorter second dose interval. Well, that does bring us to the end of our questions for this afternoon's virtual media briefing. Dr. Mackie, Dr. Dukelow, Warden Burghardt-Jesson, Mayor Holder, thank you again, as always, for your time, for sharing your insights and information with us today. And we look forward to hearing from folks again at our next virtual media briefing coming up on Thursday afternoon at 2 o'clock. So between now and then, we look forward to seeing you and speaking to you one more time. We wish you well. And that's it for today. So long for now. you.